Howdy, y'all. I'm Dr. Jeff Jarvis, and I want to talk about stroke. Let's call this our first PIM, or Performance Improvement module, shall we? I mentioned when I gave my introduction about these videos that we're going to be doing, I mentioned that we were measuring our performance against that of EMS agencies across the country using NIMSQA measures. Now, overall, we do very well compared with the rest of the nation, but we found one measure that we can do better on, one measure that we're doing slightly worse than the national average, and that is documentation of stroke scales in those patients we think are having an acute stroke. There are lots of different stroke scales out there, and they basically work about the same in terms of accuracy, but the ones we use are Cincinnati and Lamb's. If we don't perform a stroke assessment, we don't identify the stroke. And if we don't identify the stroke, we don't get the patient rapidly to an appropriate hospital where they can be treated. Now, the specific measure we're looking at here is the NIMSQA Stroke 01. It is defined as the percentage of EMS responses originating from a 911 request for patients suffering from a suspected stroke who had a stroke assessment performed during the EMS response. Now, that's a quote directly from NIMSQA. That gives you a good idea of what they are measuring. Now, the way they report this measure is as a ratio, a numerator divided by a denominator. That's a percentage. It's defined using all patients with a primary or secondary impression of stroke that are identified from a scene call. In other words, no transfers. Now, that number, all of those primary, secondary impressions, that's the denominator or bottom number. The numerator or top number is all patients in the denominator who have a stroke scale performed and documented in the chart. Now, obviously, both of these numbers highly dependent on your documentation, and that is why your charting matters. It lets us identify how well we are doing. And the one thing I want you to know about this is we will only calculate this at the system level. In other words, we're not calculating this performance on an individual medic level. So please be as honest as you can with this, because it tells us how the system is doing. Now, I'm going to go over how to do a detailed neurologic exam in another video, but for now, I want to focus on how to document a stroke in ImageTrend. So let's start by taking a look at how the MedStart system performs on this particular measure compared with the rest of the nation. What we're putting up here is a graph comparing our performance to national. And as you can see, the dotted line represents national performance averaged over the past year. The blue line represents the average performance in our system from month to month. We are slightly underperforming the national average. We're documenting stroke in 75.2% of our acute stroke patients versus the national performance at 76%. Guys, we missed it. We missed it by that much. Now, when it comes to this measure, I'm operating off of the assumption that y'all are already doing good stroke assessments. It appears that we're not doing that great of a job documenting the results of those stroke assessments. And as with most performance issues, I suspect there's probably and primarily a system-wide reason we don't document this well. Like, I don't know, maybe I don't think we've ever actually told you how to document a stroke, particularly in ways that are directed at improving performance on a specific measure. So with that in mind, I'm going to end here by playing a short video that Kirby put together that tells y'all how we want you to document strokes. Please follow these directions. Do not assume that writing the results of your stroke assessment in the narrative is sufficient. It isn't. That doesn't get the job done. Now, guys, I really want you to know I believe in you, and I know we can knock this measure absolutely out of the park. We can lead the nation on it. So let's get to it. And now, here's Kirby.
Let's talk about how you can properly document your stroke patient's symptoms and your impression in the ImageTrend software. You have a few different options available to you for these patients. One of the most important ones is indicating a complaint. The complaint section allows you to add a primary, secondary, or even third and fourth complaint for your patient. You can also indicate the time that it began. But one of the most important things that you need to select for your stroke patients is down here in the possible stroke section, indicating yes. This will tell the image trend software that you think your patient is having a stroke and that you would like to enter a Cincinnati and/or LAMS score into the documentation software. The next thing we want to do is go to our symptoms and impressions section. For your primary symptom, this is pretty self-explanatory. We want to add what the primary symptom the patient is complaining to you is. For your primary impression, if you think that your patient is having a stroke or a head bleed, you would indicate that in your primary impression section. You have stroke and bleed as your two options, and those are the most easily chosen ones. After we've selected that, we want to go to our patient care section. We want to insert an assessment. In the assessment section, you can add a brief stroke scale for your patient as far as arm drift and leg drift goes. Now, for patients who are normally paralyzed, you would be able to indicate whether or not that's normal for the patient in this section. The next thing we want to do after we insert that assessment is we want to go to our stroke assessment section. Now, in here is where you'll be able to add the Cincinnati or LAMS stroke scale. Very important, we want to know when was the last time the patient was seen well. If we're able to do that and indicate that, the easiest way to accomplish this is clicking in the box and using our minute or hour selections down here at the bottom. We also want to indicate whether or not there was head trauma at the onset of symptoms, or if there was previous stroke or previous head trauma for the patient. After we've completed that, we want to add a Cincinnati or LAMS scale. So we'll click add and we can indicate whether or not we want to add the Cincinnati or the LAMS. For the Cincinnati, we would look at the patient's speech, their facial droop, and their arm drift and make the appropriate selections. For the LAMS scale, we want to look at the facial droop, the arm drift, and the grip strength. Once we've made our selections, we would add all of the numbers up and we would indicate that here in this box. Now, after we've inserted our Cincinnati and or LAMS, and again, you can add multiples. So we did a Cincinnati already, now we can add a LAMS. We want to complete the rest of the section. We want to know, did the patient's symptoms begin between 3 and 24 hours ago? And it's a yes or no. We also want to know whether or not the symptoms that they were experiencing resolved before we got there, resolved during our care, or if they did not resolve at all. Once we've made the appropriate selections, the next thing we need to do is go to our transport and destination information section. In our destination information section, we want to select the hospital team activations. So when we're calling in a stroke alert, we want to make sure that we hit add. We want to indicate the time that we gave the alert to the best of our abilities, and we want to indicate that it was a stroke alert that was given to the facility. This is how you should properly document your stroke patients in Image Trend.